A few months back, one of our Democratic colleagues warned of a huge train wreck on the horizon, the implementation of Obamacare. And yesterday, we received another warning as Obamacare speeds down the tracks. This one came from the Government Accounting Office, which highlighted a number of missed deadlines that cast doubt on the ability of the administration to even get the law up and running by October 1st. Of course, the GAO is not the first to issue such warnings. Some of us have been sounding a similar call literally for years. And what we've said is that Obamacare is set to become a bureaucratic nightmare. Most of the law's key provisions haven't even been implemented yet. Not a single American has signed up for an exchange, and already it's turning into one big mess. It wasn't hard to see this coming. We're talking about a 2,700-page piece of legislation. We're talking about a law that's already generated more than 20,000 pages of regulations, literally a red tape tower, 7 feet tall. And we're talking about an edict that proposes to alter one of the most personal, most private aspects of our lives in a fundamental way. So it doesn't take an expert to understand what that leads to. Reams of paperwork, massive new bureaucracy, the coordination of numerous hulking government agencies, including, of course, the IRS. And it can't be done without the people the government is attempting to regulate: the doctors, the hospitals, states, small businesses, hundreds of millions of Americans actually having a clue how to comply. Nobody knows how to comply with this thing. The law is just maddeningly complex. So, of course, Obamacare is going to be a mess. Going to be a mess. We said it would be, and actually it already is. And yet, earlier this month, the President said that Obamacare was, quote, working the way it's supposed to, end quote. That is literally what he said. Maybe that's why just yesterday a survey of Americans showed only 19%, fewer than 1 in 5, believe that Obamacare will make their family better off. Only 19%. And it found a much greater number, roughly half of Americans, worried about losing the health care coverage they already have. Now, there was another survey released too, a survey of small business owners. It found that 41% of small business owners said they'd frozen hiring, literally quit hiring people, because of Obamacare. 41% of small businesses. About 20% said they'd already reduced their workforces because of it. 40% quit hiring people, 20% reducing workforce because of Obamacare. And remember, this is a law that's still being implemented, and that many businesses already seem to be laying people off. I hope that's not a preview of what we'll see once Obamacare actually comes online. But given the evidence thus far, it's hard to draw a different conclusion. The Kentucky Retail Federation recently cited Obamacare as the thing having the most impact on their business's ability to grow. As a leader of that group put it, the companies in his federation are hesitant to take on new staff or to invest in their own business growth until they know how much health care reform is going to cost. So if this is the law that's working the way it's supposed to, then it's obviously a very bad law. And it's Congress' duty to repeal bad laws, and I hope that it will. I hope my Democratic friends here in the Senate will finally work with us to do that, do just that, because we can't do it without them. They have the majority, and if they can muster the will to admit their mistake, I hope they can also find the will to work with us to start fresh on health care. This time, I hope they will actually work together with Republicans to get something done for the American people. In my view, that means pursuing effective, step-by-step reforms that can not only lower costs, but that can also be implemented effectively and understood completely by constituents we were sent here to serve. I know my constituents back in Kentucky would expect as much of us, and frankly, they should expect that much of us.